Pain and cocaine. What's the relationship between the two? Well, a patient said to me recently that they asked me a question about why would their pain get worse when they take cocaine. Strange question. I get to hear lots of different things in the physio clinic, but let me just give this explanation in today's video. Hi, my name's Coverdale. I'm a physiotherapist and author of The Pain Habit. I talk about all things pain and help patients change and let go of persistent pain. Welcome to the Pain Habit YouTube channel. Click on the subscribe button if you're new here to keep up to date with all things pain and learn a little bit more about your experience with pain and maybe how to let it go. If you've got any comments or questions, pop them in the section below and I'll do my best to answer them. So, pain and cocaine. What's the relationship between persistent pain and cocaine? Well, it's not a relationship that I'm familiar with, but lots of questions come up in clinic. And the patient asked me, why does my pain get worse or come on as soon as I take cocaine? So this is a persistent pain this person's had, and lots of questions popping up. Originally thought it was a structural issue. Thought of this problem as a trapped nerve. It's really quite a common misconception. We give something a label that we don't quite understand. It fits our belief system where we think, well, that'll do, I'm stuck with it. But there'll be a point at which someone either goes to seek help for it, or they simply live with it because they think nothing further can be done for it. So the patient asked me, why does my pain come on when I take cocaine? And the answer to this one is really simple. The pain the person is experiencing is not down to physical overload alone. It's not down to the physical structure alone. That belief is fine when there's been a recent injury, or it's within 3 months of that injury where the tissue's healing and there's been some damage that has to be recovered from. Having a protective mechanism to prompt you to protect that injury or look after it as it heals is absolutely necessary. But with persistent pain, it's more to do with the fact the body's still in a fight or flight state. It's overstimulated, and normally due to the stress chemicals in that person's system. Now that can be stress chemicals that they actually don't feel because they enjoy it, and quite often it's because their life has been stressful since childhood, so it just feels normal. It's normal, so it doesn't appear to be a negative thing. They like to be busy, like to be active, like to drive, like to be kind of achieving things and doing, and find it hard to sit still. So it feels totally natural. Or it could be obvious stressful things to that person, a sense of overload, looking after an ill relative, work stresses, relationship stresses, family health stresses. However the person perceives that situation, if it's stressful to them, that's entirely subjective. But if they're enduring a situation, that would be classed as something negative. So either way, you've got the body in a stress state, either something they're doing that they enjoy too much, or something that's not pleasant that they're having to endure too much. And the body's regulation of that is pain, physical pain. There'll have been lots of signals before that time that the person carried on with the activity, with the thought processes, with the behaviours in the situation they're in, and didn't respond to them. So as the stress chemicals get higher and higher and higher in that system, there's a point of overload, a tipping point, that once you get past all the other warnings, the body has no other regulatory system in place other than to trigger pain. And it'll trigger a pain that's been linked to the stress response. Simple as that. So you've got this really highly sensitized system. A person's already in pain through overstimulation. And what do they choose to then reduce their stress? An overstimulating activity. So the kind of things that often people use to reduce stress are pleasure-inducing behaviours, and they can give a temporary sense of pleasure, and that's chocolate, work, alcohol, drugs, casual sex, shopping, gambling. All of these things might be perceived as pleasurable by some people, but only in the short term, because they're not really stress reducing. They're almost distractions or blocking or just pleasure, trigger the pleasure centres of the brain. But you know and I know, if you hit these things too hard or too much, probably because you need to have a release from the stress, then the danger is that those behaviours themselves create pain. And if you've already hit them so hard and they've used up whatever pleasure benefits they have, that they're not really having an effect anymore, then as soon as you start to overuse that particular behaviour again, it triggers pain. So the pain the person finds so difficult to deal with because they're overloaded, then uses a behaviour that should give them pleasure, but because it's overstimulating the system that's already stimulated to the point of nearly failure, it triggers the pain. Once they explain this to the patient, it made complete sense to him. It doesn't mean it's easy to switch off their drive to use that pleasure-inducing behaviour again, because they're very addictive. All those things I mentioned are very addictive, and they haven't just come overnight, they've come over years often. And so the first part of this is understanding that pain isn't due to physical damages at all. Even though it's a physical pain, it's not solely a regulatory response to thermoreceptors, chemoreceptors or pressure receptors, and that's the response in acute pain. In persistent pain, it's more a response to the ongoing stress in someone's life and anything that triggers that stress, and that can be more good things or more bad things. Once you have that awareness, that's a great opportunity to lose the fear about the thing you think is causing you pain. Thinking that it's a physical, structural problem, that can be there, and that's only a small part of it, but it's often the stress you perceive about that structural thing that is the driver for the pain rather than the physical structure itself. So the focus then becomes on stress reducing activities that are non-destructive. These are thoughts, breathing patterns, movements and feelings. You can do them all in one go in an epiphany, or you can do them step by step, create habits of them and become pain free. Every day is a school day in clinic. We've got questions that I'm not too sure I'm going to be able to answer, but the answer's there if we look at it from a behaviour change point of view and from a neuroscience point of view, and if you can translate that into ways the patient understands, then it really does offer them a key to unlock their pain. Thanks for watching this video today. My name's Coverdale, and now take a little bit more time out for yourself and plan the next step in your recovery.